Welcome back. So the president once again expressing some new criticism for Dr. Deborah Birx of the coronavirus task force. You yourself have renewed your criticism for both Drs. Birx and Fauci, saying that they are pushing the country back in the fight against COVID. What do you mean by that?
Well, what's happening is Dr. Birx and Dr. Fauci continually undermine other health and science data that's coming out. So, for instance, the schools and CDC talking about opening up schools, they talk about the risk to children is literally 1 in a million. And Dr. Fauci and Dr. Birx, particularly Dr. Birx over the weekend, said she was going to adopt the CDC guidelines, which is 5% of overall positive COVID testing rates before you open schools. Now, the problem with that is there is no empirical data or science that says, oh, 5% is the magic number as opposed to 6% or 3%. And that is just pulling a number out of your head and saying that's going to be the mark before you go. And that's part of the problem with where Fauci and Birx have been all along. They've been inconsistent and not always science or data driven.
And so with that, it sounds like you don't fully trust Fauci or Birx. So are there other experts that you do trust that perhaps Americans should look to more so when it comes to the handling of the pandemic and how to move forward?
Yeah, I think there's some great Stanford scientists, Dr. Atlas, Dr. Ioannidis. I mean, you can look at a Yale doctor and scientist, Dr. Risch. You could look at some of the studies that have come from other nations. You look at the 56 studies that have come, for instance, on HCQ alone, and you're going to get a different picture than what Drs. Fauci and Birx have painted. And I think that is where we need to go. The other thing we need to do is get better data. I mean, there's the one thing that I agree with Dr. Fauci with, and that is, Dr. Birx with, and that is that the data has not been real good, even though we have a lot of it. It hasn't been adequately disaggregated, and nor has it been adequately accumulated.
And a lot of this information that officials are looking at, they're basing this data in order to open up schools or open up the economy. So when we've spoken before, you said that you support schools reopening in the fall. Are you worried at all that they could potentially be closing back down if schools in your state's on outbreak, like let's say Georgia experienced in its largest district recently?
Yeah, that's going to be an anomaly. But let's just face this, the facts here. We have to assess the risks. The risk for children out of school is far higher than when children are in school. So where we need to minimize risk and attack and mitigate against some of the risk is for the teachers and administrators themselves. That we can do. That's what we should be doing. And if we have districts that don't want to open up, you should actually provide some kind of scholarship money for children to go to charter schools or private schools that do want to open up. That way we get children back where they need to be, and many of them need to be in school and be educated.
And it seems to come back to this debate of it shouldn't be a federal choice, it should be a more localized choice. It always seems to come down to that. But finally, Congressman Biggs, there's a recent national poll that came out about a week ago. It said that 79% of people surveyed were for a national mask mandate. Now, you've conducted a poll on your Twitter that says the opposite. So how should officials approach these disparities when it comes to what certain parts of the country want?
I would tell you that my Twitter poll was not a scientific.
Right, of course.
There might have been some selection bias with that. But I haven't seen the crosstabs on the other polling either. But what I would say is this is really, that is a state issue. That's where that needs to be resolved. It shouldn't be resolved at the national level. And quite frankly, it should be resolved at the local levels where businesses are making the decisions, individuals are making the decisions. And what you're seeing is that polling is also indicating that something almost 90% of Americans are wearing masks and choosing to wear masks. Well, if masks are the panacea, then that's really good. And a lot of people are also social distancing. Let people make that choice, and I think they're going to make the right choice. And that's without even getting into the discussion of the efficacy of masks, which I think the fact that you're seeing outbreaks where people are wearing, 90% of people wearing masks, kind of indicates that maybe there's a problem with that as well.
And are you seeing, based on the data fluctuating, at least in your state, are you seeing people sort of adjust their habits to meet the demands?
Oh, absolutely. Yeah. I mean, look, you can go to a big box store, grocery store, hardware store, something, and they're going to mandate masks because they choose that for liability, and people put on their masks and they go in. Some people don't wear masks. But by and large, people are choosing to wear masks because that's what the private businesses are requiring. That seems to me to be the rational approach here, as opposed to a national mask mandate.
All right. Congressman Andy Biggs of Arizona discussing the ongoing pandemic with us. Thanks so much for joining us again.
Thank you so much for having me.